World Health Organization has as its goal health for all, and for hepatitis, really we can divide our work into three main categories. First of all, we're promoting advocacy, really trying to make people, general population, politicians, policymakers, everyone aware about hepatitis and how serious a problem it is and how it's the seventh leading cause of death of all causes. The second thing is the technical work that we do, which is really primarily has been the development of guidelines. These guidelines, for example, treatment guidelines for hepatitis C that we launched yesterday at our WHO symposium, are meant to promote the development of appropriate treatment programs, primarily in low and middle income countries. So these are a set of documents that we hope will be used by policymakers to develop comprehensive national plans. The third area is technical assistance, so we try to help countries directly as they develop their plans to make sure that they're appropriately planned and implemented. There's three main areas where I can see the foundation taking a lead. One is to engage beyond the normal constituency of hepatologists and to engage with communities, for example, with civil society representatives, policy leaders, public health leaders. The second area is to extend beyond just research and to talk about how to promote treatment, prevention, development of national plans, some of these areas that EASL has not really traditionally been engaged in. And the third is to extend its geographical scope. EASL, by its name, is a European foundation, but I think the issues are really global, and some parts of the world are much more affected than Europe by hepatitis. And that's where, since it's an international foundation, it really is meant to promote work around the world. WHO, at World Health Organization, we really try to partner with as many key groups as we can to promote our work. Regional hepatology organizations such as Ezel are one of the key players. Hepatologists are key opinion leaders in their countries. They're developing the new treatments. They're promoting them in their own countries. And so I think in order to move forward, we need good research, but we need to have EASL and conferences such as the ILC to promote the results of these studies so that everyone's aware of them. But so I think we really view this as a key partnership. Most of the engagement we've had with EASL is at the International Liver Congress, and I think that's this year, for example, we have three symposium. Yesterday we launched our updated our hepatitis C treatment guidelines, and it was really heartening to see there were 300 or 400 people there. The room was full. There was lots of engagement. And the second symposium on overcoming barriers to treatment, and then there's a third symposium on Sunday around testing. So we really appreciate the engagement by the EASL leadership to give us an opportunity to move the discussion and the conversation beyond the core constituencies and the core issues, which are hepatology related issues, to really take on the broader questions of, now that we have these medicines, how do we assure that people who need them get them around the world? One of the real challenges that we face, and that's come up repeatedly at this meeting, is the issue of testing. It's great to have the medicines, but if people don't know that they need them because they haven't been diagnosed, it doesn't help anyone. And that's where we really see a major effort needed to increase the number of people who are being tested and diagnosed with hepatitis. This initiative was an idea to try to identify interesting, novel ways of reaching people with testing services and linking them to care and treatment. So we put out a call for ideas and descriptions of programs that have been successful, and an international panel selected the best ones, and they'll be presented on Sunday at the symposium, where the examples from around the world, I think 5 will be presented, showing how innovative ways of reaching people, particularly those that are normally overlooked by health services. think one of the main things that we've seen this year is each year we see more and more emphasis on public health. I think this year it has really come on as a main theme of the conference. First, it is one of the themes, the public health track. The sessions have been terrific, have really been very well attended. I think each year we see more and more people coming to these sessions, and I think it's part of an overall realization that as I've said, that the testing, the development of treatments is one important step, but it's not enough. And I think we've seen with the EU sessions and a number of sessions, the engagement. I thought at the opening ceremony, in particular, there was in a room full of several thousand people. There was the declaration of the 4 major hepatology societies signing on the declaration around elimination, and that was sort of handed to the director from the WHO. So that was really a very strong signal that Ezel, as well as the other hepatology organizations, are seeing that this is the time to talk about elimination of hepatitis. ILC is really always a terrific meeting for me, because it really brings together such a broad range of partners and friends and from around the world and from different fields. I think this year what was, in addition to the sessions, in the hallway conversation, what was really interesting to see is how many representatives from different countries are saying that within their countries they see really a major change in the way the hepatitis is being talked about, and that several countries, we heard from Mongolia, from India, are really developing. Pakistan will find ways to really scale up the numbers of people getting treatment services through innovative financing arrangements and some donations. So this momentum that we've heard about and we're hoping would come really seems to be turning into a reality. So that's been the most sort of gratifying thing to observe just in the interactions. We hope in the years to come at ILC we'll have more and more presentations from these novel treatment programs that have reached that have been successful in expanding treatment services throughout the world.